But the capillary, it'll be right there. You'll see with the little red blood cell inside of it and all of that. Okay, so now what we need to do is we need to make sure that we have down our blood vessels here on the heart. So we went over these, remember our pulmonary and systemic circulation. Everybody have a good view. Sabrina, you're not blocked there, man? If you are, come right up front. Always make good use of your time. And yeah, likewise, Jasmine, if you're trying to take pictures, this gets you right over here. Right over here. Okay, anyone who's, let's get you guys clear. Okay. Everyone is settled. No one's going to block. Okay, so here we see the heart. Always at this angle, we're going to see this blood vessel right here, which is the pulmonary trunk. It divides up into the left, and over here in the back we can see the right pulmonary arteries. Remember, they're the only ones that are opposite in color. These right here are coming from the lungs. They're veins, pulmonary veins. And then if I turn it back around, can everyone see this big one coming from the top? What would that be? Superior vena cava. And then this one, sorry about that. This one coming from the bottom? Inferior vena cava. And over here? Pulmonary arteries. And in blue?
Arteries. Which stuff?
These are the pulmonary veins, and these are the arteries, and these are the pulmonary veins, and these are the pulmonary arteries. And this right here, superior vena cava, inferior vena cava, and if I turn this around, always at this angle, pulmonary trunk, and then getting to that, Nicole, right here, ascending aorta. Aortic arch, descending aorta. And then the BCS, B standing for brachiocephalic trunk, left common carotid, and S for left subclavian. Remember, these two are lefts. These are lefts, and this is just a trunk. Left common carotid and left subclavian. So let's see why, Don, let's go over here to this model. Here's our arch of aorta. Here's our left subclavian right here. Excuse me, common carotid here. Whereas on our brachiocephalic trunk, it branches up into our right common carotid and our right subclavian. And then over here, see the left, 1, 2, 3. Here's the left subclavian. Whereas over here, it comes off of the brachiocephalic trunk. So look at the video one more time at the very beginning. Yeah, I think I do. Or maybe in the middle. Just look.
You have the blood vessels lecture?
Blood vessels lecture video.
Actually, what you said in class was the heart lecture. And I've watched the heart video, but not the blood vessels.
It's on there.
It's on there.
It's there. I just
yeah, I'm sorry. Yeah, no. Well, the points were for the blood. For the heart. And the only reason I put up that blood vessel was just to try to help you to get these down as quickly. Did it help at all or not really?
Yes.
Okay. I hate to waste your times. Okay, so that then are those right there. So this would represent what?
The superior
vena cava. And what does this represent?
The
pulmonary trunk. And here on the superior vena cava, it branches into two even branches. From here to here is the left brachiocephalic vein, but from here to here is the right brachiocephalic vein. Right? Left. Now, the first branch coming off of the brachiocephalic veins is the internal jugular veins. Not so with over here. This first little branch is the vertebral arteries. But on the veins, this first branch coming off, these are the internal jugular veins. Doesn't look like it, right?
No.
That's why I hate this model. But this is all we have. And the whole entire world, we've looked even in other countries for models. This is it. So, first branch is the internal jugular, and then the third branch is the external jugular vein on the humans. So obviously I don't have it here, I can't ask it on this. Okay, now let's continue on here. What did we call this over here?
Subclavian artery.
Subclavian artery. This is the right subclavian vein. What did we call this blood vessel right here? Right axillary artery. We'll call this the right axillary vein. What did we call this down here? Ulnar artery. Ulnar vein. Radial artery. Radial vein. Common iliac artery. Common iliac vein. This one going in. Internal iliac artery. The blue one. Internal iliac vein. This red one. External iliac artery. External iliac vein. This is why I had you guys just learn those arteries, then you would have the majority of them down. Okay, now, the ones that are different. This was the superior vena cava. We said that this was the inferior vena cava. It goes past our diaphragm and it continues all the way along here as the inferior vena cava. So, inferior vena cava, but abdominal aorta, right? Abdominal aorta. Now, what did we call this red one over here going to the liver?
The hepatic artery.
Hepatic artery. And these blue ones? What about this one going to the spleen? Splenic artery, splenic vein. This one going to the stomach? Gastric artery, gastric vein.
Wait, will you do those three again?
Uh-huh. This right here, going, the blue one, right here, these blue ones right here, hepatic veins. And then they merge, just like we learned, with the inferior vena cava. Can you see this blue one right here? Who asked me that? Whoever asked me that? Oh, Nikki. This is the splenic vein. This one going to the stomach, gastric vein. What about, what should we call this blue one going to the kidney? Renal vein. What about the red one? Renal artery. Not too bad? Okay, here's the ones that are a little tricky.
Yes.
Okay, see the subclavian vein?
Yes.
We said this was the axillary artery. But then we've also got to name this one over here, which is the cephalic vein, the right cephalic vein. And then this is where it gets tricky on this model. Here's our axillary vein, right there. Oops. Here's our right axillary vein, right there. We know that this is our right subclavian vein, right there. Whereas this branch coming off, that's the right cephalic vein, right there. So where it differs, what did we call this red blood vessel? Brachial artery. They're trying to show two, and so what they did was they cut off the brachial vein. So this over here represents the brachial vein, and this one running next to it is called the basilic vein. Okay? I always tell Joel, and when we retire, we want to become rich, we make a decent blood vessel model, and I bet we could sell it to every lab in anatomy lab in the United States. All right, so Joel is the lab tech. Oh, you guys wonder who's Joel? All right, so on this one, look how nice it is. What's this blue one right here? Subclavian vein. Good, Sherry. And then what do we call this one right under the armpit? Axillary vein. Now, can you see this one coming up? Cephalic. Very good. And then over here, can you see this one? You guys can probably barely see it from where you're at. Let me turn it a little bit. Can you see this one coming down along this way? That's the basilic, the base. Randy showed me a nice way to remember. That goes along your base right here. The basilic vein goes along your base. Whereas this axillary, at that point, after it branches, that continues as the brachial. But not on this model. Here they've got the basilic coming down, kind of like down your arm or whatever. And then this one they cut off your brachial vein.
So your basilic or vein does not go down your arm?
Basilic vein. So it goes down this area right here.